Lessons from the dark side of the ICU. The ICU, or intensive care unit, is a realm that is often shrouded in a veil of mystery and fear. For many, it's a place where time seems to stand still, where the stakes are incredibly high, and where the weight of every decision can feel insurmountable. Today, I want to take you on a journey through this world, to explore the dark side of the ICU, sharing stories of loss, mistakes, and ultimately, the lessons we can learn from them. Imagine a family gathered in a waiting room, their faces etched with anxiety and fear. They're waiting for news about their loved one, who is fighting for their life in the ICU. The beeping machines, the sterile smell of antiseptic, and the hushed whispers of medical staff create an atmosphere thick with anticipation. But what happens when the news isn't what they hoped for? What happens when things go wrong? Let's start with a story that resonates deeply with many healthcare professionals. It was a typical night shift, the kind where fatigue hangs heavy in the air. The ICU was full, patients were critically ill, and one nurse, let's call her Sarah, was juggling multiple responsibilities. In the midst of it all, she made a mistake that would haunt her. A medication error, a simple miscalculation that led to a patient receiving an overdose. The immediate aftermath was chaotic. Alarms blared and the team sprang into action. But the damage was done. The family, unaware of the turmoil, waited for updates. When they were finally told, their world shattered. This wasn't just a patient. It was a father, a husband, a friend. In the days that followed, the ICU staff worked tirelessly to stabilize him, but the consequences of that error lingered. Sarah was devastated, grappling with guilt and fear. She had always prided herself on being meticulous, yet in a moment of distraction, everything changed. What can we learn from this? Mistakes can happen to anyone, no matter how experienced. The pressure in an ICU is immense, and it's easy to overlook details. But this story also highlights the importance of a culture of safety. After this incident, the hospital instituted new protocols, emphasizing double-checking medications and fostering an environment where staff felt empowered to speak up if something seemed off. It was a painful lesson, but one that ultimately led to better care for future patients. Now, let's shift gears and talk about complications. In the ICU, complications are a part of the landscape. They can arise unexpectedly, turning a seemingly stable situation into a crisis in seconds. I remember a case involving a young woman, just in her 30s, who had been admitted after a severe car accident. She had multiple injuries and was fighting for her life. The team was optimistic. She was young and strong. But then, the unexpected happened. She developed a severe infection, one that spread rapidly. The medical team worked tirelessly, throwing everything they had at it, but the infection was relentless. It was heartbreaking to watch her family cling to hope, their faces a mixture of determination and despair. Days turned into weeks, and despite all efforts, she succumbed to the infection. The loss was profound, not just for her family, but for the entire team that had fought so hard for her. From this tragedy, we learned about the importance of proactive prevention. The ICU staff began to implement more rigorous infection control protocols, focusing on prevention rather than just treatment. They held debriefings after every loss, discussing what could have been done differently, what signs could have been caught earlier. Each discussion was painful, but it was also a step toward improving care for future patients. Another aspect of the ICU that often goes unspoken is the emotional toll it takes on staff. The weight of loss can be crushing, and it's not just the patients we lose, it's the families left behind. There was a time when a beloved patient, an elderly man with a twinkle in his eye and a laugh that could light up the room, was admitted to the ICU after a heart attack. The team rallied around him, and for a while, it seemed like he was on the mend. But then, complications arose, and despite their best efforts, he passed away. The grief was palpable. The team gathered together, sharing stories about him, celebrating his life, but it was also a moment of reflection. They realized that they had been so focused on saving him that they hadn't fully engaged with his family, hadn't taken the time to understand their needs and fears. This loss led to a shift in how the ICU approached family involvement. They began to prioritize family meetings, ensuring that loved ones were included in discussions about care and treatment options. They learned to listen, to empathize, and to provide support during the most difficult times. It was a painful lesson, but it transformed the way they cared for families, making them partners in the process rather than mere observers. As we delve deeper into these stories, it's essential to recognize that the ICU is not just a place of loss, it's also a place of resilience and hope. There are moments of triumph, moments that remind us why we do this work, but those moments are often overshadowed by the darker realities we face. Take, for instance, a young mother who was admitted after a severe respiratory illness. She was fighting for her life, and the odds were stacked against her. The team worked tirelessly, implementing every possible intervention. After days of uncertainty, she began to show signs of improvement. It was a moment of joy that felt almost surreal amidst the backdrop of the ICU struggles. But even in success, there are lessons to be learned. The team realized that while they celebrated her recovery, they had neglected to address the emotional toll this experience had on her family. They had been so focused on saving her that they hadn't considered the impact on her children, who were waiting anxiously outside. From this experience, the ICU staff began to incorporate psychological support into their care plans. They recognized that healing isn't just about the physical, it's about the emotional, the mental, and the spiritual. They brought in social workers and psychologists to support families, ensuring that everyone received the care they needed, not just the patients. As we reflect on these stories, it's vital to remember that every loss, every mistake, every complication carries with it the potential for growth. The ICU is a place where we confront our vulnerabilities, where we grapple with the fragility of life. It's a place that teaches us humility, compassion, and the importance of continuous learning. To those of you watching, I encourage you to share your thoughts and experiences. Have you been touched by the ICU in some way? What lessons have you learned from your encounters with healthcare? Your stories matter, and they contribute to a broader understanding of this complex world. If you found this video engaging, please like and share it. Your support helps us reach more people, spreading awareness about the realities of the ICU and the lessons we can learn from it. And let us know what topics you'd like us to cover in future videos. Together, we can continue to explore the intricacies of healthcare, shining a light on both the triumphs and the challenges we face. As we conclude this journey through the dark side of the ICU, let's carry forward the lessons learned. Please kindly let us know what you think about this video and share your own experiences. Thanks for watching, and make sure you subscribe.